Intimate partner violence, IPV, is a challenging and critical issue that affects many lives. This episode, a companion to Therapy Training's Violent Partners course, is designed for mental health professionals at all stages. We'll navigate the dynamics of violent relationships, examining their historical and societal contexts, and discuss how these factors impact mental health outcomes. Our goal is to provide insights into recognizing signs of abuse and understanding effective support strategies for clients dealing with IPV. Today, we'll summarize key points from the course and offer additional insights that can enhance your practice. We'll cover how to identify signs of violence in intimate partner relationships, assess risk and safety, develop safety plans, and utilize trauma-informed approaches. We'll also tackle some common misconceptions surrounding this topic, ensuring you leave with a well-rounded understanding. So let's jump right in. First, it's crucial to recognize the signs of violence and abuse in intimate partner relationships. These signs may not always be overt. They can manifest in subtle ways. For instance, while physical violence is the most visible form, emotional, psychological, and financial abuse can be just as damaging, often leaving long-lasting scars. Emotional abuse might include constant criticism, manipulation, or gaslighting, where the abuser makes the victim doubt their own perceptions or feelings. Financial abuse can involve controlling a partner's access to money or resources, which limits their independence and ability to escape the situation. A staggering statistic to keep in mind is that nearly 1 in 4 women and 1 in 9 men experience severe intimate partner physical violence. This illustrates just how common this issue is, and as mental health professionals, we have a vital role to play in identifying these signs early on. So how do we assess the level of risk and safety concerns for our clients involved with violent intimate partners? The first step is to engage in open dialogue, creating a safe space where clients can share their experiences without fear of judgment. Asking direct, yet sensitive questions can be helpful. For example, you might inquire, "Has your partner ever physically harmed you or threatened you?" This can lead to deeper conversations about their experiences and feelings. Additionally, using validated assessment tools, such as the Danger Assessment Tool, can provide insight into the severity of the situation and help gauge the level of risk involved. Now, once we've identified the signs of violence and assessed the risk, the next crucial step is developing effective safety plans and coping strategies. This can be a lifeline for clients facing violence in their relationships. A safety plan is essentially a personalized, practical plan that includes steps to take before, during, and after an incident of violence. Encourage your clients to think about safe places they can go if they feel threatened, people they can reach out to for support, and resources they can access, such as shelters or hotlines. Stress the importance of having a packed bag ready to go with essentials like clothes, important documents, and medications. It's also vital to address emotional coping strategies. Encourage clients to develop a support network of trusted friends or family members who can provide emotional support. Exploring grounding techniques, mindfulness exercises, or journaling can also empower clients to cope with the emotional toll of their experiences. So, what interventions can we implement to support clients in leaving or managing violent relationships? This part can be tricky. Many people assume that simply advising someone to leave an abusive relationship is the best course of action. However, it's vital to remember that leaving can often be the most dangerous time for someone in an abusive relationship. Instead, we can focus on empowering clients. The "as" means helping them regain a sense of control over their lives and decisions. Use motivational interviewing techniques to explore their feelings about their relationship, their fears, and their hopes for the future. Together, you can create a roadmap that outlines their goals and the steps they feel comfortable taking. Now, let's shift gears a little and discuss the impact of violence on mental health. Victims of intimate partner violence often experience a range of mental health issues, including anxiety, depression, post-traumatic stress disorder, and even substance abuse. As mental health professionals, it's our responsibility to employ trauma-informed approaches in our counseling practices. This means recognizing the signs of trauma, understanding the effects it has on the individual, and integrating this knowledge into our interactions. For instance, when working with a client who has experienced violence, it's essential to create a safe and supportive environment. This can include being mindful of language, maintaining confidentiality, and respecting their autonomy. Additionally, fostering resilience and self-efficacy can help clients reclaim their power and work toward healing. Now, a significant part of supporting clients involves collaboration with community resources and support networks. Often, clients may feel isolated or unsure of where to turn for help. As therapists, we can serve as a bridge to these resources. Familiarize yourself with local shelters, hotlines, and legal aid services. Encourage clients to reach out to these organizations and inform them of their rights. Connecting clients with support groups can also be incredibly beneficial, as it allows them to share their experiences with others who understand their struggles. Let's take a moment to address some common misconceptions surrounding intimate partner violence. One prevalent myth is that abuse only occurs in certain demographics, whether based on socioeconomic status, race, or education level. In reality, intimate partner violence can happen to anyone, regardless of their background. Another misconception is that victims of abuse should just leave their partners if they're unhappy. As we discussed earlier, leaving an abusive relationship is complex and can often increase the risk of harm. It's essential to approach this with empathy and understanding, recognizing that each individual's situation is unique. We should also challenge the stereotype that abusers are always visibly violent or erratic. Many abusers can appear charming and normal in public, which complicates the situation. This reinforces the importance of understanding the broader dynamics of power and control in abusive relationships. As we wrap up this episode, I want to leave you with some thought-provoking insights. The work we do as mental health professionals is incredibly impactful. By equipping ourselves with knowledge about intimate partner violence, we can better support our clients and advocate for their safety and well-being. Remember that change often starts with a conversation. Create an environment where clients feel safe to share their experiences and empower them to take control of their narratives. If you're looking to expand your knowledge further, I encourage you to explore the course, Violent Partners, offered by Therapy Trainings. It's a valuable resource that dives deeper into these topics and provides practical tools for your practice. Visit therapytrainings.com to learn more about this and other courses available. Thank you for joining me today. As we continue to navigate the complexities of mental health, let's remain committed to being allies for those who need us the most. Until next time, take care of yourselves and each other.